Starting with news from Germany, just a few weeks ago, the European Union was clamoring for the AstraZeneca's COVID vaccine, but now very few doses have been administered in the initial days of a rollout in Germany. The AstraZeneca vaccine is facing public resistance in Germany despite a raging debate about a sluggish EU rollout of vaccines. German healthcare facilities have reported several 100,000 AstraZeneca vials sitting unused and rampant no-shows at scheduled appointments. This even after Germany's Health Minister Jens Spahn said that all the 3 vaccines approved by the bloc are safe and effective. Now the German health officials are pleading the citizens to take up AstraZeneca vaccine. According to Robert Koch Institute, 740,000 AstraZeneca doses have been delivered to Germany's 16 states, but only 107,000 doses had been used by Thursday. With more than 60% of Germans saying that they want to get vaccinated, opposition politicians blame the government for undermining faith in AstraZeneca. Meanwhile, Germany has gained some success in reducing the number of new cases. With its 3-month lockdown, the country will most likely have to extend border controls with Czech Republic and Austria if outbreaks linked to the new variant are not contained in these countries. On Thursday, Germany recorded 10,207 new cases of COVID-19 in the previous 24 hours and 534 deaths. And we are now being joined by DW correspondent Rob Watts from Berlin. Thank you so much for joining us. My first question to you is, what's being done to prevent a new resurgence in coronavirus in Germany? As I just mentioned in the report, the country may have to extend border controls with Czech Republic and Austria. What can you tell us about that?
Well, indeed, it has done exactly that, because the main threat here, or what's seen as the main threat to the currently falling figures, is the UK variant, which has arrived in Germany and is currently making up around 22% of the cases. Now, that doesn't sound like a huge proportion, but when you bear in mind that just 2 weeks ago it was only making up 6% of the cases, you can see that week on week the proportion of cases that are the British variant is doubling. So that's a real concern, and that is why they have now blocked the land border with the Czech Republic and with the Austrian region of Tyrol, where they've got high levels of this British variant already. There's also concern particularly around the town of Flensburg in northwestern Germany on the border with Denmark, where they've had a surge in the number of cases. They've gone from having around sort of 60 per 100,000 over 7 days to almost 200 per 100,000 over 7 days in just a matter of a week, if not much more. And for that reason, they are now increasing the restrictions there. From tomorrow, there's a new curfew in place where people can't go out between 9 o'clock at night and 5 o'clock in the morning. And they're also banning people from meeting people from other households, because this spike in Flensburg is being attributed to the British variant. It's thought half of the cases there are this particular mutation of the coronavirus.
All right, Robin. Now, how is the vaccination program going? As per reports, there is skepticism when it comes to the AstraZeneca vaccine. People are unwilling to take the jab. How would you explain that? Well,
yeah, the vaccine rollout has been dogged with problems across Europe. I mean, across the EU in particular, because we did have these problems a couple of weeks ago where AstraZeneca announced that it would be delivering much fewer jabs than it originally said it would be, and also there are also delays to the BioNTech Pfizer jab as well. So there's a shortage of 2 of the 3 jabs that are available. That's why it's a particular problem that we are having Germans saying that they don't want the AstraZeneca jab. There's some evidence that it is less effective than the other 2 jabs, but also that it has stronger side effects. We had an example of 300 ambulance workers in Dortmund who had the AstraZeneca jab, and a quarter of them ended up having to take some sick leave as a result of side effects that they have. So for that reason, we have seen health groups in Germany, and it has to be said in other parts of Europe, recommending that the AstraZeneca vaccine isn't given to health workers in particular.
All right, Robin. Also, another point that demands clarity here is who has actually been getting the vaccine. What can you tell us about the inoculation plan and the priority groups?
So at the moment, it's just the over 80s, healthcare workers, carers and vulnerable people who should be getting the vaccine. The government has been quite clear about that. But there have been cases of other people managing to get hold of it, be it because a doctor's surgery has some left over at the end of the day, and these people say, well, I am helping them to avoid wastage by having this. And among them, we've seen local politicians receiving them, policemen and women who aren't yet eligible, or they will be shortly, getting the vaccine and being criticised a great deal for that. The government has had to stress that politicians in particular are not a priority group here in Germany and will be much further down the pecking order. The health minister has said he'll wait his turn. He's 40 years old, Jens Spahn, so his turn could be a while off. And Angela Merkel has indeed said as well that she'll be waiting until it is the leading politicians here's turn to get the vaccine. And ahead of them are a lot of people, including police officers and also residents of refugee areas.
Interesting. Rob, thank you so much for joining us with all those details.